How filters are tested and the differences in the tests are very important to understand so you can make sure you are an eco-smart and not a waster. Testing is a complex subject, but I'll try to keep the terminology as simple as possible so you can understand the most important points. Testing methods and performance criteria vary from the USA to the EU to China and other countries, adding to the confusion. To further complicate matters, there is not one standard test for all masks. To simplify our discussion, the testing will be separated into two categories based on the application of the product: respirator tests and surgical mask tests. Respirator tests are for masks such as N95 in the US, KN95 in China, FFP2 in the EU, and on for other countries. This is the highest level of testing intended for masks used in higher risk areas such as industrial air hazards and high-risk healthcare settings. Surgical masks are tested to a lower standard than respirators since they were originally meant to be used to prevent the spread of fluids between the patient and doctor during surgeries and other procedures, not filtration. The way surgical masks are used has morphed greatly since then to include some filtration. Surgical masks are used for lower risk healthcare settings and mild pollutants. As a result, there are major differences in the two testing standards and methods which are important for you to understand. These differences are a major cause for much of the confusion. Another cause of the confusion is a basic misunderstanding of the size of the particles to be filtered depending on what the user is trying to protect themselves from. All masks and fabrics are not good filters. Cloth masks are poor filters and provide very limited protection to the user. That is why you will not find any of them that include test results. They'd all fail. According to Dr. Kazunari Unishi, an associate professor at St. Luke's International University in Tokyo, he found that cloth masks had a 100% leakage rate in terms of airborne particles penetrating the fabric and through the gap between the mask and the faces, substantially raising the risk of infection. After we explain how filters work, you will hopefully better understand why cloth masks do not work and how to better check the correct mask and filter for you. First, let's dive into the differences in the respirator and surgical tests so we can compare. We will use a comparison chart from a study by the National Library of Medicine regarding the standards for surgical respirators and masks. Respirator testing methods are shown on the left in blue, and surgical mask testing data is on the right in red. There's a lot of data, but to simplify, I've highlighted the main and key differences in the test. There are many other variables involved as well, such as particle charging and the materials used in the testing, but they are far too complicated for the layperson to understand. So we'll try to keep it as simple as possible. The purpose is to illustrate that the testing for respirators is much higher than that for surgical masks. The first key point, item 1, is the flow rate at which the testing is conducted. That is the amount of air forced through the mask during the testing. Respirators are tested at 85 liters per minute compared to 28.3 liters per minute for surgical mask tests. Let's make a visual comparison. Envision a typical half-liter bottle of water, something we can all relate to. Half a liter is also the amount of air in each normal adult breath while at rest, called the average tidal volume. So 2 bottles equals 1 liter. The testing of a surgical mask is at 28.3 liters per minute, as I mentioned. So the equivalent of 56.6 of those bottles flow through the filter area tested in 1 minute. Wow, that's a lot. However, the test for a respirator is 85 liters per minute. That flows the equivalent of 170 of those bottles through the filter in 1 minute. Whoa, that's a whole lot more. Yes, exactly 113 bottles or 200% more. Let's put this in perspective. On average, while at rest, adults take about 12 breaths per minute, or about 4 to 6 liters per minute. Let's say on an average 12 breaths and 6 liters per minute, or 12 of those bottles. A surgical mask is then tested at approximately 3.8 times the normal breathing rate, while a respirator is tested at 11.3 times the normal breathing rate. Quite a big difference. You should be starting to see the differences in the tests by now. During moderate exercise, breathing rate may rise to between 30 to 60 liters per minute or higher. These high airflows for respirator testing of 85 liters per minute were selected based on the expected upper end flow rates for hazardous workers performing typical tasks, such as coal miners and firefighters at work at an elevated breathing rate. Conversely, surgical masks are normally worn while medical personnel are more at rest, so a lower flow rate can be used. This isn't a problem until people start trying to compare surgical masks to respirators that all filter over 95%. They aren't the same, since the tests aren't the same. The second key difference is the size of the particles tested, shown as item 2. To add some scale to the size of a micron, a human hair is 60 microns. More on particle size later. This is a little harder to put into perspective, but I'll try. Respirator testing uses sodium chloride particles with a mass medium diameter of approximately 0.3 microns. Surgical mask testing uses latex spores with a mean diameter of 3 microns, not 0.3. That is a huge difference and critical, since a lot of the hazardous particles in the air are between 0.3 microns and 3 microns. Knowing the sizes of particles that you are trying to protect yourself from is critical for you to select the correct filter. More on that later also. This image provides a simple illustration of how small the particles tested are. The white circle is 60 micron, the width of a human hair. You may have heard about PM 2.5 and PM 10 regarding the pollution levels in your area. The blue inside circle is PM 10, or 10 microns. The green circle inside the blue circle is PM 2.5, or 2.5 microns. Surgical masks are tested at 3 microns, just slightly larger than the PM 2.5. There is a red dot you can't see inside the green circle that is 0.3 microns, the particle size used in testing respirators, much smaller. You should really see the big differences in how surgical masks and respirators are tested now, and that respirator tests are to a much higher standard. Item 3, the item tested, actually describes the size of the sample tested. Of course, to add more confusion, they're not the same either. Surgical mask tests an unspecified area of the filter, such as 100 square centimeters or 100 square millimeters, while respirators test the entire mask. With varying flow rates and then different sizes tested, the comparison becomes even more difficult. The entire respirator is tested since they are assuming a tight seal and that those wearing them will pass a fit test when wearing. Surgical masks are known to leak, so fit testing is not a factor. In summary, there are significant differences in the methods that surgical masks are tested using larger particles at lower airflow rates than the test methods for respirators. It is easy to then understand that the testing of a respirator is to a much higher standard than a surgical mask. These tests are then carried out to see what percentage of the particles used in the test are filtered. That's called the filtration efficiency, shown as a percentage such as 95% for an N95 mask. The differences in the tests are very important to note, so that a person is not confused when they see a surgical mask with 99% filtration efficiency versus an N95 or KN95 mask that only provides 95% efficiency. That may lead many to believe that surgical masks at 99% offer equivalent or possibly better protection than respirators at only 95%. This is a big problem with the testing system, since they are tested to much different standards to which many people are unaware. You have now been warned. N95 respirator testing is a much higher standard. Proof of the importance of this difference is published in a report from the NIH National Center for Biotechnology Information. A separate test by Oberg and Brousseau in 2008 of 9 surgical masks reported to have a filtration efficiency of greater than 95% and found filter efficiencies measured using the respirator test to be much lower, for example, 10 to 90%. Because respiratory viruses are found in the air in particles with diameters greater than 3 microns, it is important for healthcare workers and the public interested in adequate levels of protection to have masks capable of filtering particles in this size range with high efficiency. Could the governing powers have made this any more confusing? As we have shown, the tests are significantly different in the flow rate, the size of the particles tested, the area tested, and practically every other possible criteria. How in the world could anyone reasonably compare the two? The makers of surgical masks are not going to test to the higher standard since they could not report a high level of filtration. Unfortunately, the public do not understand these significant differences. This is resulting in a false sense of security in surgical masks by the public. The public wear masks they think are protecting them when they most likely are not. As a result, the inadequate masks they wear are ending up in our landfills and seas in huge proportions while providing little benefit. Another flaw arises from the ease with which particles can bypass the filtration material of a surgical mask due to the loose fit of the surgical mask against the face, mainly because of the ear loops and the nose piece, as tested by Dr. Onishi. Fit testing of respirators is a critical aspect of the testing and not performed on surgical masks. Quite frankly, they are not performed on surgical masks since it would be pointless. None would ever pass a fit test. Think about it. Have you ever had a vacuum with a break in the hose? If you did, you would quickly find that the vacuum no longer has suction since the air takes the path of least resistance through the break in the hose. A mask is the same. If there's a gap in the mask, the air is going to be sucked through the gap rather than pulled through the filter, since the gap is the path of least resistance. One of the reasons consumers find surgical masks comfortable is because they don't seal. The leaking air and the light weight make them more comfortable, but unfortunately also makes them ineffective. To bridge the testing divide, a third standard, US 3502, has been implemented in the USA. This is an attempt to circumvent the comparison dilemma of different test standards for surgical masks and respirators. This standard uses a similar testing method as respirator in flow rate and particle size, but allows for the efficiency to be judged in multiple levels, such as a level 1 for a lower performance and a level 2 for a higher performance, for both filtration efficiency and breathability. The standards set are lower than that of a respirator for level 2 and similar to a surgical mask for level 1, since this specification is targeting the general public with a higher concern given to comfort to promote long-term use of masks. As you can see in level 1, with lower performance, the filtration efficiency must be greater than 20%. But for the level 2 higher performance, it must be greater than 50%. That isn't nearly as good as a respirator testing at 95%, but probably still better than the surgical mask at 99%. Again, because the tests are performed at higher flow rates of 85 liters per second and smaller 0.3 micron particles. Breathability is tested by measuring the air pressure on both sides of the filter material while air is flowing. The pressure differential reflects how easy it is to breathe through the filter material. A low pressure differential means air easily passes through the filter material, making it easier to breathe through. In the new U.S. Standard 3502 Level 1, breathability lower performance must be less than 15 millimeters, while level 2 higher performance, it must be less than 5 millimeters. These values are also difficult to compare to respirators and surgical masks since they are tested differently and surgical masks use a different unit of measure. For the purpose of this layman comparison, a respirator standard is 35 millimeters or less, and a surgical mask is 6 millimeters. So a level 2 high standard is approximately the same breathability of a surgical mask since they are promoting comfort, and a level 1 lower standard is much easier than a respirator. There are many flaws in this standard, such as the method of leakage measurement and the area tested, but it's a step in the right direction. STYLESEAL masks and filters are tested using all three test methods to the highest standard to which the filter can pass. The ProSafe and EZ masks pass respirator KN95 tests. The ProFlow pass US 3502 Level 2 tests for both filtration and breathability. The ProCool and all air filters pass surgical mask tests. You can refer to the test results in our website. Hopefully they'll make a bit more sense now.